Hey everyone, it's Chris from chrisbeatcancer.com, and today I've got a really cool interview. I'm excited to share this with you. This is my friend Valerie Warwick, and Valerie is a nurse, an RN, who spent 17 years as an oncology nurse. And boy, does she have some stuff to share with you. And I don't want to give it all away, but let me just say this much. She did it for 17 years and finally could not do it anymore, and made a major life change, and is doing some very great stuff now today. So Valerie, thank you so much for taking the time to talk to me.
Well, thanks, Chris, for having me on.
So let's start with your story. Like, how did you get into nursing? Why did you get into nursing? And how did you end up in oncology?
Well, when I was 20, both my parents were ill. And my dad had cancer, throat cancer, and my mom had multiple sclerosis. And so there I was at 20. My mom was in the nursing profession. My great aunt who raised my mom is in the nursing profession. My sister-in-law is a nurse. So have a long background of nursing. Well, at 20, I was taking care of both my parents, and my dad had throat cancer, which is a really brutal treatment, as you can imagine.
Yeah. Did
he had
lose
a radical
his voice? Did he have the radiation and lose his voice and all that?
Yeah. Oh, yeah. And
yeah.
That was in the early 80s. In those days, they would do a radical neck. So they cut him, from here all the way down his chest.
Wow.
Took out a quarter of his tongue, all his lymph nodes, a lot of the chest muscle.
Yikes.
So, yeah, it was horrifying. And he went through radiation and chemotherapy, which didn't allow the scar to heal. So his neck opened up. So basically he had a hole through his neck. I don't know, is this too much information?
No, not at all. Not at all.
Oh my gosh.
Look, people need to know what that kind of treatment is like.
Yeah. So, there I was, 20 years old. So, and he passed away about a year or two after, probably about a year and a half. And I continued to care for my mom. And then I decided, well, I'm doing this. Why not go to nursing school, right?
Yeah.
Because the years
you're basically
passed.
acting like a nurse anyway.
Right. I thought I better get to college, right?
Yeah.
So I did go to nursing school and graduated and started working the weekends. During the week, I was a float nurse, so I floated all over the hospital. On the weekends, I would work on the oncology floor. Well, they asked me if I'd like to be permanently there, and I thought, sure, that's great. I love oncology. I love the patients. It's a very interesting area. It's extremely interesting. And so I did. And, my initial thought was, well, how can you be giving poisons to people and expect them to heal? Really. And I saw, I knew what my dad went through.
Yeah.
And I kind of resolved that in my mind, thinking, okay, well, you're on the frontier, right? It's like being in a new frontier. And you're also told that, well, there's a lot of successful stories, because you're working in the hospital, you only see the sick people, right? So there's a lot of successful stories out there at the outpatient clinic, right?
Right.
Yeah, because they're able to walk in and get their
like,
their
don't let these patients, don't let the worst ones get you down, because there are a lot of people out there that are doing really well.
Right.
That's what they tell you. Okay.
Right.
And you want to believe that, of course. I mean, if you didn't believe that, well, it would be very difficult.
Yeah, and you believe that they're working toward, finding better answers.
Finding a cure.
They're working hard doing that. And so as the years go by, you're waiting for a better answer for these people.
Yeah.
So about 2008, my best friend found out, my best friend from childhood found out that she had colon cancer with liver mets. And so that was really devastating.
Stage 4, right?
Yep, stage
Mm-hmm.
4. 50 years old,
Yeah.
2 kids. And I knew that, the treatment wasn't going to cure her. I knew that. And I knew that she would suffer a lot. And so I started to research um, everything about alternative therapies, any answer, any treatments. And it really just opened up a world to me of alternative treatments. And so it started basically with diet for me, and I started to change my diet because I had some health challenges. So I started to incorporate those things in my life because I saw the direction that my life was going health-wise, and discovered for myself that my health really did dramatically change when I changed my diet. And as time went on, as I started learning more about the treatments, it became pretty confusing, like it does for a lot of people. There's just so much out there.
Yeah.
So where do you start?
Right.
Obviously, the diet is where you start.
Yes.
But then there's a lot of contradictions there. So that can be very confusing for people. So I didn't find answers for my friend. I did not. She passed away about a year and a half after her diagnosis
did
as
she
well.
go through the conventional treatments, just standard
She
stuff?
did. She did.
Yeah.
Yeah. She she had a colon resection,
Mm-hmm.
and I think she got an infection, and then they after she got through that, they took about half her liver, I think, and then she got an abscess from that.
Yeah.
So that was really bad. And then the chemotherapy was just horrendous on her.
I had a family member, same diagnosis, and they told him if he did conventional treatment that he would live maybe about a year.
Mm-hmm.
And I sort of off the record mentioned to someone else in the family, I said, if he does that, I don't think he's going to make it 6 months.
Right.
He made it 3 months.
Yeah.
He was gone in 3 months. And I mean, it's really tough. So in the 17 years that you were as a nurse, how much progress did you see? I mean, how many improvements in treatment or success did you see? Did you feel like things got any better in 17 years?
Slightly. Well, there are the biological modifiers, like Rituxan and that sort of thing.
Explain those.
Biological modifiers, they're more targeted therapy.
Mm-hmm.
They use those on, like, the lymphomas.
Yes.
Yeah.
Well, and it's worth mentioning, testicular cancer, lymphomas,
Mm-hmm.
they've had the best improvements in survival of all cancers. Like
Right.
the non-carcinoma cancers, the non-epithelial cancers, right?
Right. And they're less toxic. We can say they're less toxic, right?
Yeah.
Right. So.
And childhood leukemia is also in that category of,
right.
Hey, they've actually made really good progress. But the problem that I see with the industry is they use those three or four cancers that they've done really well with, and they parade those as if they're making great progress with all the other cancers. And the leading cancer killers, lung, breast, and colon, have made very little progress in the last 60 years since chemotherapy started.
Right. And even though they say they've made great progress with the lymphomas,
people still dying.
Yeah, people still die, and then they get cancers later on, right, from the treatment.
Yeah.
So then you get leukemia later.
Yeah.
Which I've seen a lot.
So
right.
Tell me about some of the things. I know people watching this want to hear some of the insider stuff. Tell me some of the things. Two questions, right? First is, some of the things that you saw, right, that would probably shock people, but they need to know about. And the second thing is, and hopefully we won't forget this, but what cancer patients really don't know and need to know before they agree to standard conventional treatment, right?
Right. That's
So,
very important.
yeah, so
Yeah.
let's talk about those two things.
Okay. Well, um, as I started to learn more about natural therapies and started to hear other people's stories of success, I started to look at the patients differently, at what they really needed. And basically, what I discovered is what they really need is nutrition, first and foremost.
Amen.
They are starving to death.
Yeah.
They're literally starving to death. They're so nutritionally depleted, their body has nothing to work with. And then on the other hand, we're destroying their immune system. So basically, they're starving to death. Their cells they're completely malnourished. And then we're giving them poison. They're getting poison, and their immune system doesn't have a chance, because without your immune system, there is absolutely no way that you can recover. You need your immune system. Even if they kill all the cancer in your whole body and at the same time destroy your immune system, your cancer is going to come back because you have those circulating tumor cells. Yeah,
right?
You have circulating tumor cells.
Yep.
And they're more virulent.
I'm sorry, I didn't mean to interrupt. I just meant to say.
Oh, that's okay.
Isn't it true that chemotherapy usually does not kill cancer stem cells and circulating tumor cells?
Right. It doesn't. And then, right. That's true. Go ahead.
And so, and there's typically two scenarios. Is this correct? Either they get rid of all the cancer, right? And everybody says, yay, you're cancer free. But their immune system's destroyed and it comes back pretty quickly.
Yeah, about 4 months.
Yeah, that's sort of like the best case a lot of times. And then, or the other is they don't even get rid of it all. They just shrink it a little bit and destroy your immune system. Right.
And then you're really in trouble. Then you're really in a fix, right?
Yeah.
Because then you're chemo resistant, right? It's not going to work the same as it did before.
The body, and is this true that the body, from what I understand, the body adapts to chemotherapy. It becomes more efficient at detoxing from, let's say, just one chemo drug. And it builds up a tolerance to it, so the drug is not as poisonous.
Right.
That's what chemo resistance is, right?
Right. And if you think about it, if you think about cancer as a survival mechanism, right?
Yep.
Okay, it's trying to survive again, right? So they're pretty smart. Your body is really smart. So it's going to figure out ways to keep on going.
Yeah. And every cell in your body is adapting to protect itself from the chemo, not just the cancer cells, right?
Right. Exactly. And yeah, your body becomes, your cells become smart and they learn how to adapt. And then you have the circulating tumor cells zooming around, and they're even stronger than they were before and smarter. Mm-hmm. And so now you have a destroyed immune system. And so you're really starting at a worse place than you were before.
Well, don't cancer patients get nutritional advice from the doctor?
Oh, right. No. No, they give them Ensure, right, which is full of sugar and full of chemicals. And, they think that that's going to help them.
What do they tell them to eat when they go home? Besides
eat well, sloppy joes, right? No, they.
No, that was just me.
I don't know how
that was an isolated incident.
I know. Right. They tell them to eat everything and a lot of it, right? Whatever you can. Anything you want. Calories.
Ice cream, milkshakes.
Milkshakes. Ensure cheeseburgers. And, you see families walking in with bags of
Wendy's.
Burger King. Yeah, Wendy's, Burger King. Oh, my gosh.
Smoothie, by the way. This is
that
Wendy's.
Looks great.
Wendy's fruit smoothie.
Yeah. So, yeah, they're just nutritionally devastated. So I really started to see that in the patients. And one patient in particular, his name was Joe. And Joe had lymphoma. And His lips were completely cracked. His gums were actually bleeding all the time. He was a mess. He had a rash all over his body. It was horrible, horrible. He had his, of course, his platelets were really low. That's your clotting factors, really low. So a lot of blood in the urine. So he's just bleeding from everywhere. He looked horrible. And, at that time, I was reading a lot about vitamin C. And I said to his wife, I said, I want, that kind of looks a little bit like scurvy, but it couldn't possibly be scurvy, right? This is like 2012.
No one gets scurvy now.
No, right. So I said to the wife, why don't you ask the doctor, because I was going to ask the doctor, why don't you ask the doctor to give him some vitamin C and see what happens? Give him a little vitamin C. See if he could, give him some IV vitamin C.
IV bag?
Yeah, why not? Because the guy looks like he's starving to me.
Yeah.
So I was in the room, she asked him about it, and he said, I'm not going to do that. I don't even think we have IV vitamin C here in the hospital. And I knew that was a lie because I had given IV vitamin C as part of a treatment before.
Wow.
Yeah. I don't even think we have that here. And but he did agree to giving him some oral vitamin C 2 or 3 times a day, 500 milligrams.
Okay.
So that was good. Okay.
500 milligrams.
Yeah, 500 milligrams.
That's
I know.
not enough. Did it help?
I know. It did.
Wow. You must have really been
I was
bad.
astonished.
Yeah.
Actually, his rash cleared up.
Wow.
His gums stopped bleeding, and his mouth, all the cracking in the mouth cleared up.
Yeah.
And so I was like stunned. So the dermatologist, and then a couple days later, the dermatologist came to see him. So I was talking to the dermatologist, and I said, this was oral vitamin C.
Oh, yeah, okay.
The oral vitamin C.
Yeah.
Cleared up his mouth and his rash. And so I was talking to the dermatologist about this. Oh yeah, scurvy, yeah. Like he knew the guy had signs of scurvy.
And just didn't.
And I was just shocked that he knew this.
Yeah. Well, and can I interject something, because as you're talking, so vitamin C, for anybody watching this, is an antioxidant that the body uses to combat free radical damage.
Yeah.
Well, we all have free radical damage that happens every day as part of normal life, but when you're being poisoned with chemo and radiation, the free radical damage, it's basically explosive, right? It just goes through the roof. And it completely depletes your body's vitamin C, to zero.
Yes.
And whatever vitamin C, little bit your body can produce from, whatever little nutrition you're getting is quickly depleted by the free radicals that are in such high circulation in the body. And that's why this man had scurvy.
Right.
Essentially.
Yeah. And as well as all your other nutrients that your body has. They're all used up. They're burnt up. There's nothing left. So, and then he made a comment to me. You're not, I was commenting about the vitamin C. Oh, you're not one of those, are you? That's what he said to me. I said, yeah, I am. And then I just kind of shuffled off. I just walked away.
Careful.
Like, wow. So
thin ice.
Then the doctor ran a vitamin C panel on it. Did a test to see where he was nutritionally on the vitamin C, and of course it came back low. And then at that point he did order IV vitamin C for him. I think it was about 1,000, maybe 1,000 milligrams a day. But that did help him a lot. Yeah. It is very low. But it made a huge difference.
I did IV vitamin C, and I was doing about 40 grams per sitting, per visit, and that's 40,000 milligrams, right?
Right.
So they were giving this guy 500 milligrams, you said, right?
Right.
And I was getting 40,000. in an IV drip over about 2 hours.
Right.
So, I mean, that's high dose vitamin C therapy. And that, I mean, just for anybody watching that, like, what is out there, that's typically what patients get when they're getting high dose, right?
Right. Or between, 40 and up to 100 grams.
Yeah.
Right. Right. So Joe taught me a lot. That was kind of a pivotal point for me.
Joe, the patient. Okay. Yeah.
Joe. Yeah. Joe. And then another incident that happened pretty close in that time frame. I came to work. They said, okay, you got to garb up. You got to go into this room. This gal, she needs chemo. It's going to be about an 8-hour regime. So, but you can't come out. Once you garb up, you have to stay in. You can't come out because she has, 4 different resistant bacterias. 4.
Yeah, that's a problem.
Yeah.
So you had like MRSA and C. diff and
yes.
What else?
Klebsiella and Acinetobacteria. Yeah.
Yeah.
So one was in the lungs, one was in the urine, one was in the wound, and one was in the stool. So covered all bases.
Yeah.
So they said, oh, you don't need to wear a mask. That's fine. I said, well, I need you to call in, the infection control nurse to make sure, But you got to hurry. They're pushing, hurry, because it's going to take 8 hours. We brought her up from another floor. First red flag.
Uh-oh.
Yeah.
Why is that a red flag?
Because you don't bring an infectious patient with 4 resistant bacteria from the room she was already in on another floor to the oncology floor where all the patients are immune compromised.
Bad idea.
Yeah. So I was a little ticked off about that. Whose bright idea was that?
Yeah, it's kind of like the Ebola nurse flying across the country that everybody's talking about.
Right.
Anyway.
Yeah. So anyway, I did look it up, and I did need to wear a mask. But I mean, so I go in there. The poor lady, she has an abdominal wound. She's got 4 resistant bacterias, and we're giving her a pretty hard-hitting chemotherapy regime. Okay, that is insanity.
Yeah.
That is insane. Okay, she's not healing now. She's completely overrun with infections, and we're giving her more chemotherapy, and she's pretty much on her deathbed. So this is complete insanity.
And why are they doing that? Why do you think they're doing
that? I wasn't even aware as a nurse that they made money off the chemotherapy. I didn't know that. And I don't think the majority of nurses know that. I mean, we're just, we're not really into the business end of it. We're not.
Yeah. For anybody that's watching that has no idea what we're talking about, yes, chemotherapy drugs are bought at a discount. They're bought wholesale directly from the drug manufacturer, and they're marked up for profit and then sold to the patients or to the patient's insurance company. And about 60% of oncologists' revenue, roughly, comes from the profit off of chemo drugs. So it's the only drug in the medical industry that is allowed to be profited on by the doctors, which creates this huge conflict of interest.
Right.
People don't know.
Right. And I mean, what doctor would give somebody chemotherapy when their functional status is that poor?
Yeah.
So
a lot of it seems like criminal negligence to me.
Yeah, it really is. And they certainly wouldn't do that to their mother, right? I wouldn't think.
Yeah.
So, I've worked with good doctors, and I've worked with some, not good doctors.
It's okay to say bad.
Yeah.
Hey, there's good and bad people in the world, right?
Right.
Some of them are doctors.
Right.
That's the truth. They're not all bad, but they're not all good either.
Yeah. And and then we could talk about, they're not allowed to offer any other therapies. They are not allowed
or what happens?
To offer you. They'll get reported to the board. They'll lose their license. and they'll be shunned by their other doctor peers. It's a very tight, kind of a peer group thing.
Mm-hmm.
You know, if you sway, just like that one doctor said to me, well, you're not one of those that believes in vitamin C.
Yeah, yeah.
Yeah, well, I am. I was preaching a lot about nutrition, and I was getting looked at like I was a bit of a kook.
Yeah.
You know?
Well, I can tell you, I have so much respect for nurses, and there's a lot of nurses out there that really, they know what's up, and they're carefully trying to give good advice to patients,
because it is very risky.
Yeah.
And actually, I was discussing Curaderm with a patient's wife for squamous cell and basal cell.
Okay.
It's made from eggplant. So, yeah, someone that wanted to get back at me reported me to the board of nursing for that.
Wow.
Yeah.
Yeah.
Discussing
Yeah.
a product that is not FDA approved.
Yeah, so even if a doctor starts reading all the nutritional science research, because there are thousands of studies, published, nutritional, scientifically validated, peer-reviewed studies on the anti-cancer compounds in fruits and vegetables,
Right.
like just really simple stuff, or even spices like turmeric or garlic or ginger or oregano. If a doctor starts reading this research and thinks, wow, this is compelling,
Right.
this could really help people, and they start and they want to and they look at these sick patients and they have the same realization that you have. This poison might seem like it's helping in the short term because it shrinks tumors, but we know what's going to happen.
Right.
So maybe why don't we try this? Let's radically change your diet.
Yeah.
Let's try nutrition, right?
I love it.
What would happen to that doctor?
Yeah, he would get, oh my gosh, reported to the board. Yeah, he would, they'd sign him up for the loony farm.
Yeah, and
Right.
And, the American public doesn't know that.
Right.
They don't understand. Doctors are not allowed to use
Right.
anything besides surgery, chemo, and radiation. They're not.
Right.
And even the best, most wonderful, caring, well-meaning doctors in the world are trapped in a system
Right.
that pays them really well
Mhm.
to keep doing what they're doing despite the results. Is that
Right.
fair? Is that a fair assessment?
Right. And
And
they're
of course,
trained.
nurses as well.
The whole medical system really has been hijacked. It's been hijacked by the pharmaceutical companies because there's a pill for every ill, and then they poo-poo the nutrition, right? Oh, you can prevent disease, right? That's okay to say.
Right.
But don't you dare say that it can actually treat and cure disease and reverse disease, because then you're way out there again, right? But the fact remains that you can treat disease and you can reverse it and cure it with diet. And it's really all about diet.
It is. It is all about diet. That's the foundation. And I think people are easily, what's the word? Enticed by alternative therapies, right?
Mm-hmm.
Oh, by this supplement or this therapy or whatever, or this clinic. But at the end of the day, if they're not willing to radically change their diet, right? Hardcore nutrition has got to be the foundation.
Right.
That other stuff's not going to help them.
Right.
All the other stuff out there will help alongside nutrition, but it can't replace nutrition. Just
Right.
can't.
It can't, because there's so many phytonutrients, and we can turn on our good genes, turn off our bad genes, and that has to happen with lots of nutrition, lots of real food, whole food nutrition.
So what made you finally leave the oncology nursing profession?
Well, it was a culmination, really, of just seeing all the poor outcomes, and then in my own life, the change that happened through my diet change was just phenomenal. And I just couldn't be a part of it anymore. I just couldn't. I had to find a way to be on the other side.
Yeah.
to be on the other side.
So what did you do?
So I just kind of leapt off. I just leaped.
Yeah.
I did.
Yeah.
So I um, so I moved to Arizona. I started working in alternative clinics, which I've been in a few. I did learn a lot, and I did learn about, what was going on in the alternative clinics, what they did. So what I came away with was you don't have to go away to a faraway clinic,
Mm-hmm.
but you really need some support to put together a program for yourself. And there are resources that you can utilize. So take, for instance, the vitamin C therapy that the Riordan Clinic pretty much wrote the protocol for that.
Mm-hmm.
So you can go to their website at the Riordan Clinic.
I'll put a link below the video.
And you can download their protocol, their vitamin C protocol.
Yep.
So you can take that with you, and you can go to a naturopathic doctor or the doctor of your choice who will do this therapy for you, and they can follow the protocol.
Yep.
So it's not that difficult to do. It's pretty simple. Especially, it should be for a doctor to be able to take this protocol and do it for you. So that's one of the therapies.
What are some of the others that you feel like maybe stand above? There's a lot of stuff out there, but what are some of the ones that you feel really confident about? Not obviously, there's no guarantees, but
right. Well, the vitamin C therapy, alpha lipoic acid, IV.
Okay.
Ozone therapy, I think, is the bomb. I just love ozone.
Like ozone saunas?
No, IV ozone.
IV ozone, okay.
IV ozone. A doctor friend of mine, Dr. Silver in Scottsdale, taught me how to do ozone. Yep. And mostly because he wanted it done on himself, right? He wants to have a backup nurse that knows how to do it.
That's funny, yeah.
Yeah, so he gets it about 3 times a week, right? So he taught me, the wonders of ozone therapy.
Talk about it.
It's just amazing.
Explain it.
Okay,
what does ozone do when you put it in your body?
Well, oh my gosh, it does so many things. It's a powerful antioxidant, right? It oxygenates all the cells. Oh my gosh, it actually helps you to absorb nutrients. It actually heals. It detoxifies. It's anti-aging. It reverses disease. It's a miracle.
Yeah, ozone's pretty awesome. I'm a big fan too.
Yeah.
I never had the IVs, but I drink ozonated water.
Yeah.
And I have had ozone sauna therapy. And
really, when you think of it, you can't live without oxygen for 4 minutes while you're goner. It's really the most powerful thing that you can do for your body to bring healing to your body.
Yeah. What's your opinion on hyperbaric oxygen?
I think it's great. I think any kind of oxygen therapy that you can do, whether it's hyperbaric or EWAT, exercise with oxygen therapy.
Okay. Is that where you're exercising but you're breathing oxygen?
Right. They put a face mask on. They turn the oxygen up to 10 liters. And then you...
run on a treadmill or something?
Yeah, you run on a treadmill, or you can use a stationary bike. Right, that's a great therapy. And you can learn about that at oxygenhealingtherapies.com.
Great. I'll put links. Yep. I'll put links. Everything we're talking about, there will be links
oxygenhealingtherapies.com. That's a great website to learn about ozone and rectal insufflation. You can do it vaginally. If you have cervical cancer, you can do it vaginally. And, that goes right through the tissues. If you've got cancer in your belly, it'll go right into those tissues. It's a great thing to do.
What else is out there?
Oh my gosh. The GB4000.
Yep.
The GB4000.
That's essentially the Royal Rife technology, right?
Yes.
Rife technology. Yep.
Yep. So that would be part of my arsenal. Oh, and meditation. Meditation will increase your immune system, decrease stress, because stress really does a number on your immune system. It can shut it down.
Absolutely.
I never realized, the impact that stress has on your immune system. It really does shut it down.
Every cancer patient has major stress in
Yeah.
their life. I've talked to so many. I know you have too, because you do coaching, which we'll get
Right.
to that. But yeah, every cancer patient has major chronic stress in their life before
Right.
they're diagnosed.
Right.
Leading up to it, that's suppressing their immunity and making them vulnerable.
That's right. That's
and
right.
Then they get the diagnosis, and their stress just goes through the roof. I mean, now it's 10 times worse than it was before. The
That's
fear
right.
and the worry and the anxiety, and it's so destructive, so immunosuppressant. And that's one of the things that I really try to help people with, and I suppose you do too, is how to handle and eliminate as much stress from their life as possible.
Right.
Yeah.
And there's been a lot of study on that. I think there's a website, alternative-cancer-care.org, maybe, that talks about the psycho-oncology. And it really does map out a pathway, how it shuts down your immune system and how it leads to cancer.
Yeah.
It's amazing. And then we know that sugar shuts down your immune system. Sugar will shut down your immune system for about 4 to 6 hours, every sugar hit you take. So you get stressed out, and then what do?
Yeah.
Go eat some sugar.
Comfort food, right?
Comfort
You
food.
go eat a Snickers or a Wendy's
It's a double
Frosty.
whammy, right?
We're really
It's a
picking on
double
Wendy's
whammy.
today. Okay,
So-
so you left oncology, right?
I
You're
left
just like,
oncology.
I'm out of here. So what exactly are you doing now? You're coaching, right?
I'm doing cancer coaching at mywellnesstutor.com.
Okay.
And
And
I
you
love it.
basically, you're just helping people find options, helping them understand what's out there.
Right, helping them understand what they can do to take control of their health. And there are decisions and non-toxic ways of healing. And one of the first things I tell people is about the natural substances test, the chemotherapy and natural substances test. A lot of people don't even know that exists. Their oncologist didn't tell them about it. So
Explain what that is for people that don't.
So they draw your blood.
Yep.
That's RGC Gen Lab draws your blood, and they will test your blood and your circulating tumor cells or cancer cells against many of the known anti-cancer natural substances. And they will also test it against any chemotherapies, any chemotherapies, and they will tell you what works against your cancer, what natural substance will kill your cancer cell.
Is this the Greek test?
It is the Greek test.
Okay. Also known as the chemosensitivity test, right?
Right.
Okay. So if you ever hear somebody talk about the Greek test or the chemosensitivity test, it's a mouthful.
Right.
This
So
is what we're talking about.
Yeah. So it does test about with the natural substances and the biological modifiers and the chemotherapy drugs.
Yeah.
It will tell you if you have pathways that are broken that can be repaired, detoxification pathways, all kinds of information available, so that you can plan your attack.
Very powerful test, and I've heard testimonials from people that basically they said, my oncologist said I needed to do, let's just say FOLFOX or whatever,
Right.
and I got this chemosensitivity test, and it said that wouldn't even work.
Right.
And so, there was no point in even taking those drugs. It would have had no effect on me.
Right. And another one is the Oncoblot. The Oncoblot can tell you if you have the number of circulating tumor cells. And so it can tell you if your cancer is coming back or can detect early cancers. So you can have that done with your physical. you can have an Oncoblot test. Oncoblot.com.
Okay.
Yeah. So you'd have to go there. I'm sure that RGCC probably has something in that realm as well.
You know, some people watching this are going to be newly diagnosed.
Mm-hmm.
And to those people, what would you tell them? You know, what would you say to those people that are they just got diagnosed, they're looking for answers? You know, you have the voice of experience. What do they need to know?
Well, they need to know that they do have choices, and they need to know that chemotherapy and radiation are toxic, and very, very rarely, I don't even know how they work. You know, despite the chemo, really, I think that despite the chemo, the body heals. So there are answers. They can get the lab work as the, you know, to let them know what is going to work for them. They can change their diet, which has a far more powerful effect for healing the body than anything else. They can look at their life and see, you know, what kind of lifestyle factors brought them to where they are. And they can increase their oxygen, start breathing that oxygen and pedaling away. And get the hyperbaric oxygen therapy, get the high-dose vitamin C. I mean, I saw some miraculous healing with the high-dose vitamin C. One gal, a family hired me to take care of her, and we were doing high-dose vitamin C, nano silver, and Myers cocktails. Mm-hmm. Lots of nutraceuticals. Yeah.
Just for anybody who wants to know, that's she had IV vitamins, basically.
Yeah. She had arthritis her whole life. She was fairly crippled from it. The high-dose vitamin C completely healed the arthritis. She could move all her joints without any pain. So the high-dose vitamin C is really good for pain, arthritis. It's really great for everything.
Yeah. Well, you said something earlier that
get sidetracked.
That is so true. You know, sometimes people will say to me, you know, it's you're a miracle. You know, and I'll say, you know, I really don't feel like a miracle. What a miracle to me is anyone that goes through all those brutal treatments and somehow stays cancer-free and lives, you know, 10 or 15 or 20 years. That is so much more of a miracle to me. That's right. That they can endure all that and somehow get well versus someone who changes their life and supports their body's ability to heal, to do what it does normally. Right. That's just normal human body stuff, you know? Right. So, anyway, could not agree with you more. Well, Valerie, thank you so much. Oh, you're so welcome, Chris. For doing this interview. Again, let's let people know where they can find you. Oh, and the hemp. We didn't even talk about the hemp. Please, yes. Oh my gosh, the cannabis oil. Let's talk about cannabis oil. Where's my mind? The cannabis oil is amazing. Do it. It's awesome. So what have you seen? Tell me what you've seen. Oh my gosh, tongue cancer completely healed, lymphomas, leukemias, breast cancer, colon cancer, you name it. Mm-hmm. Cannabis oil has got to be part of the arsenal. Yeah. It is just amazing. What do you think the best resource for someone to learn about cannabis oil is? I should have written some of them down. It's okay. You can email them to me. I'll put them below our video. Okay, I will. Yeah. So I have several. I have a ton of good resources. Yeah, there's a lot of info out there about it, but you know, the problem with cannabis oil, as you know, is it's illegal in a lot of states. So you have to go to Colorado or California pretty much to get it, right? Or Washington now. Washington now is legal. California, for medical use. Actually, there's a lot of states, I think, that you can get it for medical use. Things are changing pretty quickly, yeah. Right. I don't think they usually have the oil as part of their, because they're restricting it. I know here they're restricting
There's some parts in California that are restricting the oil.
Really?
Some parts you can get the oil, and some parts you can't.
Do you have any idea why?
No, not really. Not really. I don't know why. Some parts, like where I'm here now, they're trying to shut down all the clinics. I'm in California right now, in the Santa Clara Valley, in the Silicon Valley. So.
And they're trying to shut the clinics down?
Well,
you mean like the dispensaries?
Yeah, the dispensaries. They don't want them.
Just kind of like, we don't want this in our neighborhood kind of thing?
Right.
Yeah.
So people have to realize that it's a powerful medicine.
Yep.
It's a medicine.
Yep.
So.
And you know, it's funny. I'm glad you said that. So glad, because it reminded me of something I was thinking about the other day is, you know, cocaine and heroin and cannabis are all very powerful medicines. And they're all illegal because the pharmaceutical industry wanted to control them and patent them. So a lot of pharmaceuticals are heroin derivatives and cocaine derivatives, right? Mm-hmm. And of course, using them for recreational purposes, not advised, right?
Right.
Can certainly destroy your life. I mean, they're potent and powerful, much more so than cannabis. But the point is, I think a lot of people don't understand the reason those drugs were outlawed was not because the government was concerned about people using them recreationally. It was because the pharmaceutical industry saw their value and wanted to basically have exclusive rights to them to use as painkillers, you know?
Right. And, you know, cannabis is a great painkiller. And much safer than morphine or Dilaudid. It doesn't suppress your your respiratory, you know. The central nervous system. It doesn't suppress the central nervous system, so it's much safer.
Yeah.
You know, nobody's ever stopped breathing from cannabis, right?
Right. We've had a few that almost overdosed on Cheetos, though.
You might feel like you're. You might have a bad body reaction, but you're going to be okay.
Okay, well, that's as good a note as any to end this on. Thank you again.
Oh, you're so welcome.
Tons of links. I'll post them below the video. Thank you for sharing your knowledge, your experience, and really for having the courage to walk away from, I'm sure, what was a very lucrative career. 17 years as an RN, you're making pretty good money.
Oh, know? Yeah.
And so thank you. I'm so glad we did this. I can't wait to get it out. Well,
thanks for sharing your story too, Chris. You're a great inspiration.
Well, shucks. Thanks. Okay, your site, one more time, is?
Oh, mywellnesstutor.com.
Mywellnesstutor.com. Valerie Warwick, thank you so much. And everyone, check her site out. Thanks for watching. Please like this video. Please share it. The world needs to hear this.
Yes.
Thanks again.